Hello, my name is Dr. Sanjay Sharma. I'm a board-certified plastic and reconstructive surgeon. I've been practicing in Austin, Texas since 2003, and my basic tenet for practice in medicine is dedication, compassion, and excellence. So I went into medicine, as most medical students do, just trying to learn everything about medicine. I gravitated towards surgery because I think that had, for me, the most impact in trying to help somebody who has an acute problem. And as far as plastic surgery, I found that as the surgeon, if you will. We can help with reconstruction, we can help with cancer diagnoses, we can help with acute trauma. So I gravitated towards plastic surgery largely because it gives me the opportunity to operate in all parts of the body and really affect somebody's health directly. So within plastic surgery, as broad-based as it is, there are multiple areas where you can focus. One can be a cancer specialist and do breast reconstruction, which is very rewarding. And I chose to go into hand and wrist reconstruction. And beyond that, my plastic surgery, I went ahead and did an orthopedic fellowship as well because I wanted to learn the intricate anatomy and really appreciate how our hands can translate our mind's activities into actionable events. And for me to sit across a patient and say, I can help you and hold their hand, that's what's very rewarding for me. I have multiple practitioners in my group, and I think what I like about this situation, or this setup, is that the patient has the opportunity to see specialists for craniofacial, for breast cancer reconstruction, for hand surgery, and I have the ability to interact with my colleagues and bounce ideas, and that just makes medicine and healthcare that much more better. In my practice, I think we pride ourselves on listening to the patient first, and that is, you're going to come see me and we're going to have a conversation. I'm going to get to know you. You're going to tell me what bothers you. I'm going to give you some advice, and it may not be surgical. It may be that perhaps we try an alternate therapies. But realistically, healthcare and medicine is not about fixing a problem, but finding a solution. And that's what I hope to achieve most with all my patients. Being in plastic surgery, I have the ability to treat a patient acutely and have them return to as near normal activities as quick as possible, get them back to work and have them feel like their problem has been solved. But I also enjoy the face-to-face time with patients. And so you develop that when you have patients who have challenging diagnoses and challenging problems to fix. One of my patients have been in practice for over 15 years. It's not just one problem, but there's several other issues that may come up that I'll be able to have advice. So I love having the continuity of care in my practice and seeing some of my patients and seeing their kids and seeing their grandkids. It's been very rewarding. So some of my other pastimes that get me away from medicine includes fly fishing. I enjoy fly fishing. Can't say I'm a very good fisherman, but I like fly fishing. Also, I like to teach residents. We do have the opportunity to expand upon our knowledge and propagate that on to future generations, and I think that's also rewarding about my practice too, is the ability to help young students and young residents move on with their practice specialty.